Did you realize that over 34 million people in the United States have diabetes? And if you have diabetes and you have diabetic nerve pain, we have just the guy for you to check out. It is Dr. Josiah Fitzsimmons from Diabetic Neuropathy joining us right now. Dr. J, how are you, sir?
Hey, Lou. I'm doing fantastic. Thanks for asking.
Right now, you are board certified in neuropathy, and we're talking about diabetes here this morning and diabetic nerve pain. What is diabetic nerve pain?
You know, great question. Diabetic nerve pain is essentially diabetic neuropathy, and diabetic neuropathy is a serious complication that affects about 50% of people with diabetes. It's where their nerve cells are actually damaged or destroyed due to consistently high blood sugar.
Now, is that the same thing as peripheral neuropathy?
Exactly. It's a breakdown of the nerves in the peripheral or their hands or their feet, parts of their body, where their nerves aren't able to communicate back to their brain appropriately. And that's when you get a lot of the sensations, numbness, tingling, burning types of sensations.
Okay, now is it possible to reverse diabetic nerve pain?
Great question. The short answer is yes. Okay, but there's so many people with nerve damage, we have to first evaluate and diagnose down to the exact percentage how much loss they have, because once you get up over 80% loss, typically it can never be fully reversed. So our goal is to try and catch that as soon as we possibly can.
All right, so what kind of treatments do you guys use for diabetic nerve pain?
So at Diabetic Neuropathy, we use state-of-the-art process. We use 4 different parts. And so the whole goal is to regenerate the nerves, restore the arteries, get the blood flow circulation back in the hands, legs, or feet, and then actually recreate that protective coating around your nerves. The process is actually a long-term solution, not just a quick fix.
All right, it sounds like it's working too. We have one of your patients, I believe Dennis, with some comments on this.
I'm taking medicine from the doctor to help relieve the pain, but that was not trying to cure it. So we got the call, got in, and come down and visit with the doctor, and he said he thought he could still help me. I was in 3rd stage, and he needed to do something pretty soon, or, you know, he couldn't do nothing. So we started, and immediately I started feeling the difference in a week. I come 3 days a week first, and I do my therapy every day, light therapy and the water therapy. And boy, I could just tell the difference.
Well, he said he could just tell the difference. He said within a week he noticed a big difference. Now, you have a special that you're offering right now to our viewers in case you are one of the 50% that have diabetes that are suffering from diabetic nerve pain. And tell everybody what you're offering here this morning.
Yeah, so we're offering a full consultation, a full exam, where we calculate down the exact percentage, and then a full report of findings. So like Dennis, he hadn't felt his feet in years, and just weeks into our protocol, he felt hot water for the first time in years.
Wow, that's amazing, something that simple. But again, you want to call them. You want 755-PAIN is the number to call to make an appointment here, $49. This is normally about $250 for people, just so you have an idea there. So take advantage of this. But now, if somebody is watching this right now and they have diabetic nerve pain and they're saying, yeah, I need to get in, I want to see you, how long is it going to take for me to get an appointment over at Vero?
Great question. Thankfully, we have 7 doctors here all under one roof where we address specific needs and individualized treatment plans for all of our patients. So give us a call. There's really no reason to live in pain. Let's try and get you in as soon as possible. And like I said earlier, we really want to catch you before you reach 80% loss.
Right, so you want to take advantage of this, and you can get the person in, you can get the diagnosis, and then you can walk them through the steps, right?
Exactly.
Yeah, how amazing is that? One more time, Dr. J, tell everybody how they need to get a hold of you if you're experiencing this type of pain and you want to get some relief and get some relief in short order. Again, how should they do that?
Fastest way is just give us a call, 515-755-PAIN. That's really the easiest way, 755-PAIN. Call us, we'll try and get you in the schedule as soon as we possibly can, get that test calculated to the exact percentage where you're at, and then we'll get you going as soon as we possibly can.
Right, and it's really easy to get to right off of I-35 on Mill Civic. Takes you less than a minute to get there off of the interstate, so very convenient. People drive for hours to go to Diabetic Neuropathy, and you'll go in there and you'll be able to find out why. Dr. Josiah Fitzsimmons, thank you so much for giving us this information, and I think people are really going to be able to take advantage of this and be relieved of pain. That is so great to hear. Thank you so much.
Absolutely. Thank you.
All right, there you have it. Viral neuropathy. If you have diabetic pain, that's where you need to go to get checked out and find out how you can eliminate that pain.